So we'll be going in a slightly different angle for the next talk. Dr. Buchholz is a world leader in urology. He has authored more than 300 articles and book chapters in world-class scientific publications. Trained in Germany, Switzerland, and Australia, he was the Director of Stone Services at the Royal London Hospital and board member of the Stone section of the European Association of Urology. He now works in Dubai. So please welcome Dr. Noor Buchholz, who will be speaking about metabolism and common urological diseases, the prostate and stones.
So good day, and I want to thank the organizers for the very kind invitation to come to Melbourne. I'm really happy to be here. And after we have seen an anesthetist talking, I don't feel that odd out anymore here. But the difference is that I'll be actually talking about urology. If I can get this going, yeah. So this may be pretty close to an image some of you may have of a surgeon or even a urologist. Due to patient demand and the not so unimportant fact that I'm married to a nutritional physician, I developed an interest in nutrition as well. It's in its infancy, so I collected some academic urologists around me and we did some evidence gathering, and this is what I want to share with you. Now we're coming to prostate cancer. Now I will of course not advocate to treat prostate cancer with nutrition. I'm too much a school medicine man for that. But prostate cancer is the most diagnosed, the most common cancer in men. 1.6 million cases per year, 366,000 deaths per year. But PSA screening has led to a lot of localized, low aggressivity prostate cancer. So the men actually survive their cancer and live for a long time. So that's where nutrition comes in, supporting recurrence, prevent recurrence, support recovery, and maybe even prevent the cancer in the first place. We know the risk factors are age, race, and genetics, family history. If you have a localized prostate cancer, then usually the therapy is a radical one, so radical surgery or radical radiotherapy. So basically you take the prostate out or destroy it completely. If the prostate cancer is spread out of the prostate, then you need to treat the whole body. So the treatment of choice then is LH, RH antagonists or anti-androgens, or a combination of both. And if you have an advanced metastatic prostate cancer, then there is some chemotherapy and estrogen treatment. Interestingly, 25 to 40% of prostate cancer patients use complementary alternative medicines. And here are some key facts taken from the literature. Increased risk of prostate cancer in Asians that switch to a Western diet, for example, by immigration to Australia or America. There seems to be an increased risk of prostate cancer with a milk-based diet. There seems to be an increased risk with alcohol for non-advanced prostate cancer, so low-grade prostate cancer. There seems to be a risk for recurrence after radical therapy if you have a folate deficiency, and there seems to be a higher risk of prostate-specific death if you are on a saturated fat diet. Now, on the contrary, lycopenes seem to reduce the risk of cancer. A high coffee intake, I don't know how that works, but high coffee intake obviously seems to reduce the risk of prostate cancer. And the highly unsaturated fats seem to reduce the risk of prostate cancers. Now, soy and green tea seem to reduce the risk of prostate cancer, but only so far in Asians. So why that is in Asians, whether that is a bias in the studies or there is an additional genetic makeup, we don't know yet. Now let's talk first about calcium. As you know, calcium has a lot of functions in the body. I'm not going through that. And we get our calcium mainly from food and increasingly from supplements. But there are some studies that suggest that a high total calcium intake has a higher risk for advanced prostate cancer. So if you choose to get a prostate cancer and you are a milk drinker, then you get a more aggressive form of prostate cancer. That's what it says in simple words. Now let's go to the green tea. We know from many studies that green tea is said to have a protective effect for cardiovascular disease and many cancers, and that includes prostate cancer. And the active compound is polyphenols, and mainly the catechin, and within the catechin group it's the, I have to read that now, epigallocatechin 3 gallate, EGCG, not ECG. Huh? Okay, so EGCG has been shown to be a potent modulator of prostate carcinogenesis. It can suppress prostate cancer cell proliferation, and it's a potent and selective pro-apoptotic activity in prostate cancer cell lines in vitro. Now, this is all laboratory research, right? But it may give us some ideas what it is able to do. Now, if we look at animals, more specifically mice, then green tea can actually prevent, reduce, or have a lower aggressivity for the prostate cancer. But that's in mice. So what in men? Well, I'm coming back to the Asian countries. We know that the Asian countries have the lowest incidence of prostate cancer, and that if Asians move to Western countries, they get more prostate cancer. So there must be something, and it is thought that green tea does play a big role. Unfortunately, there are not many human trials, and there are 2 randomized control trials that actually showed that a high intake of green tea leads to less progression to prostate cancer from a PIN, which is a prostatic intraepithelial neoplasia, which is a histological diagnosis of some abnormal cells which we regard as a precancerosis in the prostate. Lycopenes. People have looked into lycopenes, natural pigment. It inhibits androgen receptor expression in prostate cancer cells. It reduces prostate cancer cell proliferation, and it affects the insulin-like growth factor. Again, these are laboratory studies, but they may show us what it is able to do if it's in the right context. Unfortunately, human trials have been inconsistent. Pomegranate. Many people like pomegranate. Again, it's the polyphenols that are the active component here. And they do, again, inhibit prostate cancer cell lines in vitro and lead to apoptotic cell death. They do have an influence on the cytochrome pathways. And at least in rodents, they can prevent prostate cancer. That's good news, isn't it, if you're a rodent? If you're not, there's only one trial on men on pomegranate, and it shows that actually the rise in PSA, which is the marker for BPH as well as prostate cancer, is slowed down in men who had pomegranate, right? So there's some effect, but we are very much in the infancy to find out what should it be. Now, in 2004, there was a big hype because in the US there was a study started on selenium and on vitamin E on prostate cancer, because there were some studies, epidemiological and preclinical studies, showing that there is a big promise in these two. So they started a huge study, 35,000 participants in 400 centers. And they had to stop the study after a few years because there was no statistical significant difference in the rate of prostate cancer in those who had selenium and vitamin E and those who didn't. Then a few years later, they did a sub-analysis of the data, a stratified analysis. And what did they find? There was actually an increased risk of high-grade prostate cancer, more aggressive form of prostate cancer in those who had more selenium. That was quite an unexpected finding. Now, they also looked at vitamin E. And it was actually from laboratory studies known that vitamin E can act as a tumor suppressor in prostate cancer. The sub-analysis finally showed that there was actually a 17% increase in prostate cancers in patients who had vitamin E. Right, so the study, it was a good study because it showed exactly the opposite of what was expected. Good, let's go to soy. The active component in soy for prostate cancer is thought to be the isoflavones that act as phytoestrogens. And they have an influence on prostate cancer, on various prostate cancer pathways. Unfortunately, animal studies are conflicting, and in humans we only have epidemiological studies that seem to show that there's a decrease in prostate cancer if you have a high soy intake. Then people set out to do early phase clinical trials. Unfortunately, all these trials are flawed because the setup of these trials is either incorrect or inconsistent. So we have to say at this stage that there's no conclusive evidence about soy and prostate cancer. People have looked into citrus, pectin, and vitamin D, and again, these results were completely inconclusive. So what can we conclude from all these inconclusions? We might want to give our patients green tea, lycopenes, and pomegranate. They might work, but at least they won't do any harm, hopefully. What we certainly should avoid is a high dairy diet. We should avoid selenium and vitamin E, contrary to earlier beliefs. And unless we are Asians, we probably shouldn't embark into eating a lot of soy because we don't know whether it does us good or not.